This is Radio Health Journal. I'm Reed Pence. This week, what will the economy look like months or years down the road once the pandemic is over?
So I'm worried a lot of people are going to be thrown out of work and are never going to find a way back.
How the COVID economy will still be affecting us 10 years from now when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
When you are coming from a different demographic and you are a minority, it could be very challenging for you to actually succeed in the industry.
The changing face of construction in the U.S. Then,
it took about 3 hours of labor in Latin America to produce a pound of coffee.
The complicated rise of coffee. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
It's a widely held belief that if only America could open up again, we'd put this whole pandemic behind us and quickly get back to normal. Businesses would reopen, workers would go back to their jobs, and the economy would start humming again. However, an analysis of a number of pandemic-triggered economic downturns shows that that dream is likely not true. Experts say opening things up again too soon adds to the death toll and typically makes the economy worse than if people had simply ridden it out staying home. One reason? People who die contribute nothing to the economy for the rest of their expected lifespans. They become an economic drain.
The last big pandemic that affected the U.S., the 1918 influenza pandemic, affected the United States at a very different time. We can still learn from it, and what we learned from the 1918 influenza pandemic is that there are some permanent economic costs. And those permanent costs will be higher in areas of higher mortality.
That's Dr. Martin Anderson, assistant professor of economics at the Bryan School of Business and Economics at the University of North Carolina at Greensboro.
The thing that's fairly clear in the data is it's not a binary choice of do I try to reduce mortality or do I try to reopen the economy. Reopening the economy too early is going to have larger detrimental effects in the long term than simply allowing the economy to continue in the sort of shutdown state for a little bit longer. In the long term, doing one, so promoting public health and trying to reduce the size of this pandemic, will also achieve the second goal of preventing long-term harm to the economy. So that's sort of what we've learned from the 1918 flu, both within the United States, but also in a number of cross-country comparisons, where fairly regularly we see that areas that had higher mortality from the flu were areas that suffered economically in the medium to longer term.
Predicting the long-term economic damage of the pandemic depends on a variety of unknowns. For example, when the country actually begins to reopen. That will undoubtedly give us an economic bump. But if it's too soon, a second spike in deaths would then spark another downturn, a W-shaped economic recovery dragged down by people who are even more afraid of doing what they used to do. Dr. Mark Muro is a senior fellow in the Metropolitan Policy Program at the Brookings Institution.
There's no doubt that the habits being created during social distancing may well stick around a while. I mean, I think it's hard to imagine that people who have been jittery about transmission of disease and locked in their homes about it for months on end are then suddenly going to return to shaking hands and gathering in crowds and feeling comfortable about all of that. So I think there will be an increase in distancing in society and all kinds of aspects of that.
That makes this recession different from the one we had in 2008 and from the Depression of the 1930s, even though some of the numbers have become eerily similar. In 1933, the nationwide jobless rate was about 25%. Today, nearly 20% of people have lost their jobs in just the last 6 weeks. But Anderson says just how similar this pandemic-triggered recession is to more typical ones is a matter of debate among economists.
My own view is that these job losses are qualitatively different. You know, it's not as if the jobs have disappeared. It's just the employer has had to temporarily shut down, has temporarily had to furlough workers and things like that. So I think this could be quite different than, for example, the 2008 recession, even though the numbers right now in terms of number of people out of work and things like that are vastly outstripping the 2007, 2008 recession. So there are a lot of reasons to say, oh, this looks like it could be a very large and potentially very damaging recession.
However, the rapid shedding of jobs was fueled as much by furloughs as layoffs, and that makes a difference.
You don't necessarily have the same kind of destruction of firms, of employment relationships and things like that, despite the fact that people are leaving work. I mean, I think about just local restaurants in the area where I live. Many of them are closing, at least temporarily, and so that's going to create job losses and increases in unemployment, but it's not obvious that those job losses and increases in unemployment are going to be permanent. So it sort of ties back into this idea of what's the long-term harm going to be, that it really depends on, can we reopen the economy, in what form can we do so? So I think if this pandemic peak remains relatively short, if we're able to not be shut down for too long, my view is that this will look very different than a traditional recession. As the length of the shutdown gets longer and longer and longer, this might start looking more like a traditional recession in terms of, significant losses of jobs, the need for substantial stimulus and things like that, even after the end of the stay-at-home orders and things like that.
As the pandemic shutdown drags on, some people believe that massive economic changes will result, that everything will change. Muro disagrees to a point.
I actually don't think everything will change. I think many things that are already underway will be intensified. So the future will be more intensely what we have now. And what we have now is an extremely uneven economy where different industries, different workers, different places have extremely different fortunes. And I think, unfortunately, much of that is going to be intensified by the pandemic and its aftermath.
Anderson believes that this long-standing economic inequality, which has only increased in recent years, will also make recovery from this recession more difficult.
Part of that is because this inequality makes it hard for certain groups to engage in social distancing. I mean, disproportionately, people of color and lower-income Americans are going to have a harder time socially distancing than higher-income Americans. Again, I think about myself. I'm able to do my job from home. I can telework. But the people who work at the local grocery store, they can't. And that's going to lead to some pretty serious differences in terms of what the recovery might look like. This income inequality also means that a lot of Americans just are not in a position to absorb this idea that they're going to be out of work for an extended period of time.
Frontline workers, certainly retail people, food service people, I think not only are being horrendously disrupted right now as their jobs go away, but there's certainly questions about how these jobs will return and how many of them will. I'm very concerned about this. I'm an advocate of automation. The country probably is not automated enough. We are not productive enough, and these technologies can help us, but we don't have in place the kind of training and retraining and upskilling opportunities to help people manage these disruptions. So I'm worried a lot of people are going to be thrown out of work and are never going to find a way back.
The recovery bills passed by Congress will ease some of the inequality, and Anderson says that works two ways.
We're literally paying people cash, essentially, to stay home. And I think that's going to be incredibly helpful for mitigating some of these economic inequalities so that lower-income people and people of color are not disproportionately burdened by both the sort of the health and other effects of COVID, as well as being better positioned for recovery.
The Congressional Recovery Plan also maintains relationships between employer and employee, which would otherwise be severed.
The Payroll Protection Plan keeps someone on payroll, so they notionally retain this relationship with their employer. That's going to be a really good thing for facilitating people getting back to these jobs once the all clear, so to speak, is sounded. The epidemiological side of this is just how long are we going to have to continue social distancing? I mean, I feel like repeating myself consistently that the social distancing aspect of this is really important for understanding how much damage is going to be done to the economy. And these policies that are effectively encouraging social distancing, I think, are actually going to lead to less economic damage in the long term.
However, once the 8-week payroll protection plan runs out, what then? How many workers who've been kept on the payroll will then be let go? Clearly, some retail stores may never recover, some restaurants may never reopen, and some industries may take the opportunity to replace their workers with robots. Muro says in the last several recessions, automation increased.
Even though it might seem that human labor would be cheaper given a jobs crisis, what actually happens is that the bottom line of firms and revenue deteriorates much faster. So people actually become relatively more expensive to survive. Firms embrace either automation, maybe AI in the white-collar space, and you see more automation, not less. I also would throw in here the realities of both social distancing and sanitation. Add to this, in many areas such as food service or retail, again, that human relationship between the retail seller and the customer may be viewed dubiously.
That makes something like an Amazon Go, an automated store, really attractive. One other result of this recession, as foreseen by Muro, is that big tech will get even bigger.
There is explosive, use of new tech gear, whether it's telecommuting, and also because of its huge cash positions, it's going to be able to buy distressed assets all around the economy, both in tech and outside tech. The so-called FANG group, Facebook, Amazon, Apple, Google, all of these already have massive positions within tech and literally large cash positions. I think that all of those effects will be intensified in terms of buying startups out of the so-called kill zone near them or entering new industries. Amazon buying Whole Foods is a great example of what we could see much more of.
Certainly in the short run, no one feels economically safe. Millions are already out of work, and surveys show that 25% of those who still have jobs fear they won't before the year is out, so they're not spending. It'll take more than opening up the country again, or even a vaccine, to get past the economic wreckage of the COVID-19 pandemic. Some experts believe that we won't get over it for decades. You can find out more about all of our guests on our website, radiohealthjournal.org. I'm Reed Pence.
Coming up, doctor visits on your smartphone when Radio Health Journal continues.
Blood clots affect about 900,000 Americans each year, resulting in about 100,000 deaths, more than from AIDS, breast cancer, and motor vehicle crashes combined. Hospitalization, surgery, and physical trauma are major factors that put you at risk for blood clots, according to Dr. Gregory Maynard, Chief Quality Officer at the University of California, Davis Medical Center.
About half of all blood clots occur during a hospital stay or within 90 days of one. Most of these blood clots can be prevented, but fewer than half of hospital patients receive proper prevention measures. So before you're admitted to the hospital, talk with your doctor and develop a blood clot prevention plan.
Anyone can develop a blood clot. The Centers for Disease Control and Prevention advises that you know the signs. Signs of a blood clot in the legs or arms include pain and swelling with skin that's warm to the touch, red or discolored. Signs of blood clots in your lungs are difficulty breathing, chest pain that worsens with a deep breath, coughing up blood, and a faster than normal or irregular heartbeat. If you think you have a blood clot, seek immediate medical care. Find out more from the National Blood Clot Alliance at stoptheclot.org.
It's National Women's Health Week, and the National Blood Clot Alliance and the Alexandra Rowan Foundation are urging women to give careful consideration to the choices they make when selecting a birth control method. The birth control pill is the #1 contraceptive choice among the nation's more than 60 million women of childbearing age. While experts say that the pill is safe and effective, they caution that hormonal birth control containing estrogen, including the pill, patch, or ring, can pose risks, including the risk for potentially deadly blood clots. And this risk can be significantly greater among women who have other risk factors, such as a genetic clotting disorder or previous blood clot. To help minimize their risk, women are encouraged to visit womenandbloodclots.org, where they can get a risk assessment tool to review with their physician to help determine their best contraception options, as well as information about the symptoms of potentially fatal blood clots. Know your risk and your options. Visit womenandbloodclots.org. That's womenandbloodclots.org.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
Whatever kind of takes the edge off, right? Whether it's a drink, whether it's food, whether it's even shopping or Netflixing, I think that's what a lot of people are regressing to at this point.
Addiction in the pandemic.
Then, no graduations, no weddings, no funerals. What it means to lose our rituals during the pandemic.
It is a big deal, and it is a big deal in the larger scope of our human need to mark a special occasion.
All that and more on Radio Health Journal.